Good morning. My name is Tracy Terlindi, health educator. And today we're going to be talking about reducing maternal mortality in African American women and why it is a public health concern. African American women are dying from maternal mortality more than any other race. Maternal mortality can be described as a woman passing away within 42 days after giving birth. African American are 3 times more likely to die from pregnancy or childbirth complications than white women. They have a higher risk of developing cardiovascular disease, hypertension, and preeclampsia. And Georgia and Mississippi have the highest maternal mortality rates due to a larger African American population and more rural communities. In the United States, 17.2 women die per 100,000 births from maternal mortality. African American women are dying at a rate of 40 deaths per 100,000 births in maternal mortality. That is such a higher rate than the national average. So why is this? One is social determinants of health, which is education, community, employment, access to healthcare, access to fresh and nutritious foods, as well as racial discrimination in healthcare. But it does not matter the socioeconomic status of the woman. An African American woman who has a high education and makes a lot of money and has employment is just as at risk of maternal mortality as an African American woman who is unemployed and of low socioeconomic status. So let's take a look at some of the things that increase the risk, looking at the socio-ecological model. So when we look at the individual level, things that help decrease the risk of maternal mortality is living a healthy lifestyle and having a low risk of chronic disease. These can influence to have positive pregnancy and postpartum outcomes. Race, being African American women, just increases your risk of having poor pregnancy and postpartum outcomes. At the interpersonal level, access to care can reduce negative pregnancy and postpartum outcomes. And lack of family and social support can hinder those birth and postpartum outcomes in African American women. At the organizational level, having federal qualified healthcare centers in those low-income communities that provide primary healthcare services can influence positive pregnancy and postpartum outcomes. Employers and lack of maternity leave in the U.S. increases the risk of negative health outcomes with pregnancy and postpartum. Many women need to return to work before the 6 to 12 week postpartum due to needing the income and not having maternity leave. At the community level, having assets such as public transportation, federally qualified health clinics, parks, grocery stores, schools can provide a woman with proper access to care, healthy foods, education, and safe areas to promote positive health outcomes and reduce stress. Health disparities such as racial discrimination increases the risk of maternal mortality. At the policy level, Healthy People 2020 has a goal to decrease maternal mortality. And one thing that hinders positive pregnancy and postpartum outcomes is lack of routine postpartum healthcare checkups. Many insurance companies, including Medicaid, only pay for 1 visit postpartum or up to 2 with a cesarean section. Women who develop chronic disease, preeclampsia, during their pregnancy may need to be seen weekly to make sure that that chronic disease is being managed to reduce that maternal mortality rate. So proposed interventions to decrease maternal mortality in the African American population. 1. School-based health clinics with reproductive health services. This is going to provide teens reproductive health care and contraceptives within the school, so we can see a decrease in teen pregnancy rates and STIs, and also give them knowledge for reproductive health care. Mobile reproductive health clinics. These mobile vans can go into low income areas and rural communities and provide health care for those who do not have transportation and are limited to where they can go. This will increase this will increase access to health care early on in pregnancy and better chronic disease management for these women. Grady Memorial Interpregnancy Care Program will follow African American women up to 2 years after having a poor pregnancy outcome. So this is going to increase their knowledge of their reproductive health care, better chronic disease management, decrease short interpregnancy intervals, so we can decrease low birth weight and prematurity as well. So how are we going to evaluate these interventions once we implement them? How are we going to see success? We're going to see success because these adolescents are going to be using contraceptives. We're going to see the decrease in teen pregnancy and STIs after the program is implemented compared to before. We're going to see increased prenatal care in those women who live in rural communities and low-income communities. We're going to see reduced poor pregnancy outcomes. We're going to see better chronic disease management. We're going to see a reduced short interpregnancy interval. We're going to measure this by collecting data on pregnancies before and after the program was initiated. We're going to survey these participants in each group, see what's working for them, what they've learned, what they want to know, what can we do better? How many women are utilizing the services and the programs? Over time, is it increasing how many women we are seeing? We're also going to be collecting the data on their lab and blood work for their chronic disease management. Is their hypertension under control? Is their blood pressure reducing? Are they managing diabetes better? These are all things that we're going to collect so we know that these programs are having a success. Barriers that we're going to consider is limited participation or dropping out of the programs. And so what we're going to do is make sure that we're collaborating with our stakeholders and other agencies within the community. We're going to advertise these, and we're going to make sure that other agencies are referring these high-risk women to our programs so we can get them early and reduce their risk of poor pregnancy and birth outcomes. We're going to provide incentives to keep these participants, keep them coming back to these programs so we can continue success. So looking at the logic model, the inputs we need are the community partners, the stakeholders, the pharmacies, the laboratories, healthcare centers, healthcare providers, the health department, schools, mental health facilities, funding, equipment, trained professionals, support staff, contraceptives. All of these things are going to go into the interventions, the school-based clinics, the mobile reproductive health clinics, Grady Memorial Interpregnancy Care Program. And then we're going to provide knowledge on reproductive health care, provide contraceptives, provide care on chronic disease management. We're going to be in the low-income areas, the rural communities. We're going to continuation of health care for these women. So we'll see those adolescents using the contraceptives, the decrease in the STIs, the increase in prenatal care, the decrease in preterm and low birth weight deliveries. We're going to see decrease in short interpregnancy intervals. We're going to see better chronic disease management. And all of these things that we are doing is going to reduce the rate of maternal mortality in African American women. These are all going to have this impact in the communities. And do this one thing, because we have to provide the education, we have to provide the intervention, we have to see the short-term outcomes to see the overall goal of reducing the maternal mortality rate in African American women. Thank you.